Hello all, today we'll discuss about the COVID vaccine controversy that's again come back to the headlines in the last few days. Actually, COVID first wave, second wave and small other waves have paused and it's been a couple of years now. The world is coming off the vaccines, the PPEs, the masks and everything. So why the controversy now? And I will break this discussion into a few parts. The first part, which I wanted to answer is, should we panic and what all should we know? The first thing. Second is, let us know all the facts about vaccines, how trials are conducted, how vaccines are released, effects, side effects and everything. And third, let us know a bit more about those two vaccines that were administered in India, the Covishield and the Covaxin. And fourth, let us know which all countries produced what vaccines and why just the Covishield and the Covaxin and the Indian vaccines are in controversy. There were at least about 12 to 15 countries that researched and produced vaccines, and no other vaccine is in controversy, especially the Pfizer and the Moderna ones that were the American made. And then we'll come to all the tidbits and the easy questions and the investigation that we were going through when the COVID was, and then our politicians and their jokes, actually, right? So what's the controversy and what's been happening in the last few days? Basically, there was a high court judgment in the UK recently about one of those cases, and that was filed a long time ago. And the second thing was, AstraZeneca has actually used the word withdrawn our vaccine. But basically, if you just go down to the small print, AstraZeneca has withdrawn the COVID vaccine because there are too many vaccines on the pharmacy shelves at the moment, and the AstraZeneca's Covishield is now a older version. There is more research and then newer version, so it is, they don't need to be on the shelf. So that is why it has withdrawn. But just the word withdrawn, and then the politicians has used it to say, like, see, they have withdrawn, so there was something wrong with that. No, it has withdrawn because we have moved on. And second thing about this court case, so basically there were about 51 payouts resulting in about a 900 to about 1,000 crores from AstraZeneca to the severely affected patients who had immediate side effects. And then and the first answer what we need to know is whether we should panic now. No, because the main things what the pharmaceutical company has answered to the high court is, are there big term side effects? Yes, but they were all given out as information when the COVID vaccines was released in emergency at that point of time, because the risks were so less compared to the benefits at that point of time, though they were given all emergency permissions. So there were lots of organizations involved in this, like the American FDA, the Indian ICMR, the World Health Organization, the UK-based NICE guidelines, and then various other reports were published even in the big journals before these vaccines were already released. So now the vaccines are released. India is covered 80% with Covishield and 20% by Covaxin. First, let us cover the Covishield. Covishield was actually produced by AstraZeneca, which is a UK-based company based in Cambridge, and part of it is owned by another Swedish entity. So it's a UK-based organization based in UK, in Cambridge, but the research was done at the Oxford University. India only physically produced the vaccines at the Serum Institute because we had a huge capacity to produce the vaccines, but the basic research and everything was done in the UK, and it was a major vaccine in India. And then after a few crore of people were vaccinated in India, UK also accepted, and AstraZeneca was one of the major vaccines in the UK as well. So when the vaccine was released, any vaccine, even the small paracetamol or the aspirin or the basic medication for diabetes, the metformin, carries their own side effect. And each of these, even small medication, can actually kill a patient who is allergic to that. So each medication, no medication, including the paracetamol, is safe. So a live or a RNA, DNA vaccine like the COVID vaccine obviously carries risks with it. So there are 2 or 3 points that are for discussion. Does it cause clots or thrombosis? Does it cause drop in platelet? Does it cause this new heart attacks and strokes? The answer is actually yes, in the acute phase. And they were all like it was very clear that it could be a 1 in a 7 lakh vaccine that could give a heart attack as a stroke. That was all clearly mentioned when these vaccines came out. And should we be discussing it now? No. So when you take a paracetamol, it's out of the system. It's called half-life in about 8 hours, and then in 16 hours, most of the paracetamol tablet that you have taken is out of the system. So the vaccines, its side effects could usually last 1, 2, 3, 4 weeks as in an acute phase, and then carry on for another 6 months. That's why you have to take the booster dose, because the first effect of the first dose is waning off. Then you have to take a booster dose. So if the vaccine is and its effects are there for lifelong, should we take a booster? No. So about 3 years later, should we be still discussing about it? No, it's all just a political controversy. See, basically, apart from India, UK, and the America, even Turkey, Iran, China, Russia, and Australia produced their own vaccines. There were at least about 40 to 50 trade names that were in use when the vaccine business was ongoing. Why is not even one of them in controversy? So that is where we need to find out why the controversy is always created towards AstraZeneca's Covishield that was manufactured in India, and the Covaxin. Covaxin was even more India based, so it was the Bharat Biotech that done all the research, and it was produced all in India, based in Hyderabad, and 20% of the vaccines, bulk of vaccines that were given in India were Covaxin. And small side effects like a bit of a rash, a small subcutaneous nodule, a bit of diarrhea, and they have all passed off now, right? And then mainly, why the discussion about this is, there is always a fight in between these big pharma giants, and each time it's about the share value, it is about their market value, about different things. Maybe they are coming out with something new, they want to mudsling at others. So the only question I want to ask, and I don't want to answer, and I want you to ponder over, is why is there no controversy about the Pfizer vaccine, the Comirnaty, and the Moderna vaccine, the Spikevax? So the Sanofi also produced a new vaccine, and if I have to just read out to you the Chinese vaccines, there were about 9 vaccines they produced, and the trade names were Sinopharm, Zifivax, Vivo1, Coronavac, and other countries that produced the vaccines were Turkey, South Korea, Iran, Canada, and Australia, and there was a Johnson & Johnson, Janssen as well. No controversy about it, because they are all the vaccines that are produced by whatever we call the developed nations. So always fingers are pointed towards us most of the times. So just the answer finally is, and the jokes apart, so Rahul Gandhi, Mulayam's son from the Samajwadi Party, they were reluctant to take the vaccine. They wanted to promote the Moderna and the Pfizer, which didn't happen. So now they have come out with a new joke like, the Samajwadi Party wants a free ECG for everyone who has got chest pain, because they say each chest pain because of the vaccine. And the other joke going on in Gujarat is that the opposition wants any chest pain and a heart attack should be compensated with at least 10 to 12, 15 lakhs, because that is a side effect of what Modi ji has given. Right. So, and the last thing is, any medication, if it is a vaccine or a tablet, that even before it comes out, the risks and the benefits are weighed, and safety, efficacy, all the side effects are taken into consideration and even printed, and you just check all these pieces of paper that are there in the box that come along with the medication. Everybody has got a full side effect profile for you to read before you start to use the medication. And then there are so many types of sort of trials or whatever that are published by the medical people. It is a long list. Short-term trials, long-term trials, retrospective trials, comparative trials, what we call head-to-head, randomized control trials, etc. So let us not get into the depth of it. The only final conclusion is, should we panic? No, not at all. Thank you.